Hey everyone, this is Dr. Walters again. Just wanted to offer you a short video of some focus points for this week in week 7, and then let you know that, yay, you made it over the halfway mark. So congratulations. I'm going to go ahead and share my screen with you. All right. So as you will note, week 7 is dealing with chemical neurotransmission. So this is really foundational to psychopharmacology. So there's some key information that you really need to be focusing on this week. And also know that all of this information is going to be seen throughout the rest of the program. So you're going to see a lot of this stuff repeated throughout other courses. And it's just so that can be ingrained into your learning and into the new knowledge banks that you're forming. Again, these are really key concepts to understanding the psychotropic drugs, the targets, and how they're being utilized to treat our patients. So I'll quickly go over the little document that I've put together for you. And really, I just did this as some key points, and you can go back and fill in. Now, know that this is not all-inclusive of what you should be studying, but this should help you prioritize what you're studying and what you need to be looking for and pulling out additional information for and making notes. So you want to note, again, the anatomy, physiology, pathophysiology associated with neurotransmission. So you want to note these, what the definitions of these are, what their functions are, what's happening at these specific locations, okay? And then you want to know with the synapse, how are those reset mechanisms occurring and what are those reset mechanisms? So again, this is very, very key to understanding neurotransmission. The next that I put on here was intoxication and withdrawal, and then efficacy and severe side effects. So basically you want to note that what goes up is going to come down. So anything that goes in there into the brain is being utilized for any treatment, or it's a drug being utilized in other ways. And we want to know that everything is going to rise, but then it's also going to drop and bottom out, right? And we see this with addiction. We see this with things such as caffeine, right? You get this quick high, or from sugar, and then you bottom out. So you're never at baseline when you have intoxication. You're up here, and then with withdrawal, you're not back at baseline. Instead, you're under that. So just know that those have an inverse relationship. And then the same for efficacy and severe side effects. So with greater efficacy is going to come some greater risk. So you're going to have more severe side effects. So just note that relationship there. You want to know the definitions of agonists, partial agonists, antagonists, inverse agonists. Know the differences in those. Those are very, very important with psychopharm. And then you're going to want to know the enzyme targets, receptors, the G-link proteins. Again, that's discussed in this unit, and you'll see some key content areas related to those. So with neurotransmitters, I kind of broke down some major ones here, made a couple notes. Again, this is not all-inclusive. You need to be focusing in on the major ones and making yourself some notes, because you're going to be utilizing these throughout the program. But you want to know what their function is, and are they excitatory or inhibitory? So that kind of lets you know what category that they're falling into. So those are some key points to know. And then what symptoms are associated with that specific neurotransmitter. So the way this is going to help you moving forward into clinical practice is you're going to see some specific symptoms, and you're going to think, okay, this is what neurotransmitter might be involved. Now, what pharmaceutical am I going to prescribe in treatment in order to address this? And that comes, of course, after you have your differential diagnosis and you're making a diagnosis. And all of that pulls together so that you can identify how you need to be formalizing your treatment plan. And then once you start treating the patient, at times you'll get opposite effects of what you want. So then you know, okay, we need to move to this route. So just think along those lines towards actual clinical practice and how you're going to utilize this information. Again, it's all a puzzle. You have all these little parts and pieces, and you're trying to fit it all together for your use in clinical practice to treat patients. So again, like I said, I've broke each one of these down for you. And then the next section here, I've put some information. You have the cytochrome P450, so that is touched on in this specific unit. One of the things that you want to note, and this is very specific to your certification exam, are some statistics involved with that and the prevalence. So 10% of all Caucasians are going to have this specific genetic mutation, and 20% of Asians are going to have this specific one showing. Just kind of note those. I put 2 different ones here for you to note what to be looking for so that you can make your own notes. And then you have some drugs that are inhibitors and some that are inducers. So you want to know what those main drugs are. Because when you're dealing with like the cytochrome P450, then we know that those drugs are going through the liver, right? They're being utilized that way. So we want to see what specific drugs are being interacted there. So this has to do with the metabolism and how the drug is being broken down. And is it first pass, second pass? So just make note of those things. And then again, these are some things for clinical practice. When you're assessing the patient, you want to look, have they had any past medical history of liver disease or kidney disease? Because anything like that, then these specific drugs that are being metabolized within the liver, those are going to be ones that you want to avoid with those patients, because you'll be able to reach toxic levels because the liver is not able to break that down. And then here are just a couple extras that I put in this document for you to look up. And that is the HLA-B and MTHFR. So you want to look up what those are. Specifically for Stevens-Johnson syndrome and TENS, I had a patient just recently, and it was not a psychiatric medication, but a patient contacted me for their son, and they had been given Bactrim, and he quickly developed Stevens-Johnson syndrome. Thank goodness she caught it the very first day, and they were able to send him to a burn unit. But you definitely want to, again, look these up. And this is all involved in genetics. So again, we're touching on that epigenetics portion that we deal with in any clinical practice, but especially with psych, we want to be looking at those. And then I put on here, know your normal lab values. And I know that you learn this in your RN program. However, depending on what unit you worked on, some of you may be extremely familiar with reading some lab results, and others may not be familiar with reading lab results. So I, again, just want to remind you, know what your normal lab values are. Know where your potassium should be. Know where your calcium should be. Because, again, that comes into play when you are treating patients, when you're looking at certain drugs that you want to be utilizing with patients versus others. That's some very important information that you want to know. So again, like I said, this is just a focus document of where to start. Hopefully it helps. If you have any additional questions, as usual, post those on the discussion board. I'll try to get in there and get right to that and answer that for you. I think, like I said, I pulled out some key concepts. Some of these are going to be review from previous chapters and previous units that we've already studied, but they go much more in depth this week. So just dig in there and do as much as you can, and hopefully it's going to all start falling together. I know I received a couple emails from some of you that said, the light bulb kind of went off in the last couple of weeks and some things started coming together. So you're going to see that happening more and more week to week as we continue moving through the course. And then again, like I said in that video from Module 5, you're also going to see as you move through the program, oh, wait, I recall this, and this makes sense now. So just give yourself some grace and know that it's a lot of information, and you guys are doing great, but it's information that is key and very, very foundational to psychiatric mental health nurse practitioner practice. Okay, so it's all important. I know, like I said, we keep saying there's a lot of information, but it's all information that you need to know. And that is very, very important. So again, focus document here for you guys. Reach out if you have any additional questions. Hopefully this is helpful. Let me know if it is. If it isn't, if there's some other ideas that you would want me to pull together for you to kind of help focus your studies. So lastly, I'm going to try to give you guys a study tip each week also. So the one study tip I already gave you was about the note cards and how I split everything up. The second study tip I'm going to give you is concept mapping. If you didn't do that in undergrad, it is an amazing way to study. So you'll take a disease and that'll be your internal circle. And then you'll kind of branch off from that and just jot down your ideas. So it's kind of like brainstorming, but you put it together in an organized way so you can see all these bubbles with all the information. So that was a super helpful way for me to learn neurotransmission, specific drugs that were associated with specific neurotransmitters, specific disorders that were associated with neurotransmitters, specific ones. So that might be helpful to you. It may not. But again, just wanted to offer that tip to you. So I hope you have a wonderful rest of your week, and I will talk to you soon.